Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? State budgets across the country are under pressure as federal Medicaid cuts threaten to compromise local hospitals if state funding isn't preserved. Each state faces a unique healthcare challenge, but none are unaffected by H.R. 1's deep cuts to Medicaid reimbursement. So far, nearly half of the states have signed their budgets for fiscal year 2027, and some reducing state Medicaid funding and some trying to close the spending gap that H.R. 1 created. States initiating additional cuts to Medicaid include Colorado, Kentucky, and Idaho, where a handful of states, including Connecticut and New Mexico, have boosted their healthcare spending to sustain hospitals through federal policy changes. On to the damage report. During last week alone, hundreds of behavioral health positions were cut across Washington, Texas, and Colorado. As hospitals wind down their behavioral health centers and eliminate staffing, employment opportunities deteriorate in rural communities, and patients suffer as access to care is cut short. The damage will only grow when states leave healthcare spending budgets lacking and vital programs defunded. And now for today's success story. Last week, hospitals throughout the country celebrated National Hospital Week to recognize the work of healthcare teams across every avenue of patient care. At Hillsdale Hospital, we encouraged our community to learn about their local hospital, get involved with engagement opportunities, and advocate for adequate funding and support programs. Thank you to all our hospitals and communities that participated in our celebration. Thank you to our sources for this episode: National Conference of State Legislatures, Aspen Times, Hearst, Connecticut Media Group, Idaho Capital Sun, KY Policy, KRWG Public Media, and Modern Healthcare.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlong, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.